Hello everyone, I am Dr. Bodhisatwa Choudhuri, Consultant Rheumatologist, ILS Hospital, Howrah. Today we are going to talk about rheumatoid arthritis or RA. Now, RA is a chronic autoimmune disorder. It is a long-term inflammatory joint disorder which involves various short and long joints, including small joints of hand, shoulder, wrist, elbows, knees, etc. It can also involve other organs including your eyes, heart, kidney and liver. The disease is mostly insidious onset, slowly develops over time, but sometimes it can present as an acute disease. Who gets RA? RA is a very common disease for female. Actually, females are 2 times more prone to have RA than males. It is mostly seen in middle-aged women, but sometimes it can be seen on young patients, which we call juvenile rheumatoid arthritis, and in elderly when we call it late-onset rheumatoid arthritis. Now, what are the causes of RA? Being an autoimmune disorder, RA, the exact cause is quite unknown. But what happens in an autoimmune disorder, the immune system of our body, which normally attacks the infected or abnormal cells, starts attacking the normal cells, mostly lining the joints and other organs. As a result, it causes damage to that specific joint. It is a hereditary and genetic component has been found to be significantly impacting the life modality of RA. As we already discussed, it is more common in female, but if your first order relative has an RA, you have a chance of having RA. Other risk factors of RA are smoking, obesity and stressful life. Features. Now this disease, as we already discussed, is developed slowly over time, most commonly. It starts with small joints of hand, then progresses to wrists, shoulders, elbows, and then can affect other joints like knees, ankles. It rarely involves the spine. In some patients also, it can present as an acute life-threatening illness. In these patients, joint pain and swelling develops only over days, causing severe redness, inflammation and pain, and disease progresses very rapidly, sometimes involving other organs as well. The commonest features of RA are symmetrical joint involvement with joint pain, swelling and stiffness, which is most commonly seen in the morning period. In the long run, there can be joint deformities, loss of function of the joint, and if it starts involving other organs, like in eyes, it can cause eye pain and redness. For lung, it can cause lung fibrosis leading to breathing difficulty. In liver, it can cause chronic liver disease, and in kidney, it can cause chronic kidney disease. How does RA affect our body? Now, the immune cells of body do not work properly in a patient's of RA. As we discussed, they start attacking the normal cells, which are the cartilage tissues in the joint. Now, as the synovium of the cartilage gets inflamed, it slowly gets sloughed off, exposing the underlying cartilage. And gradually over time, with friction and inflammation, the cartilage gets destroyed as well, causing significant pain and swelling of that joint, and in the long run, exposes the bone, causing bony deformities. How is RA diagnosed? First and foremost, definitely a good proper history. How the pain develops, where the pain starts, when the stiffness is there, it is morning or evening, whether any family member has a history of RA, all these things matters. After taking proper history, clinical examination of all the joints, including joint mobility, needs to be tested. Then comes blood tests. The blood test, the markers initially to be taken are ESR and CRP, which get increased in case of RA, and rheumatoid factor, anti-CCP antibody, they are also tested, which act as a serological marker. Rarely, anti-nuclear antibody may also come out to be positive. Finally, X-rays. X-rays of hand, wrist and knees, they are commonly done to see is there any joint erosion or not. How can RA be managed? After initiation of early diagnosis, early treatment is to be initiated. If we can start treatment in the very onset of the disease, the long-term prognosis is best. Our motto and goal of treatment is hit hard, hit fast. The goal is to decrease the joint inflammation, increase joint function, and prevent the chances of deformity. The medicines that are commonly used start with, in the initial stages, NSAIDs or painkillers and steroids. Both of these drugs are used for a short course of time to targeting reduction of pain and joint inflammation. Next comes the specific targeted drugs, which called the DMARDs or disease modifying anti-rheumatic drugs. These are methotrexate, leflunomide, hydroxychloroquine and sulfasalazine. These drugs not only reduces the pain and inflammation of the joints, but in the long run they actually reduces the progression of the disease itself. Lastly comes biologics. Biologics can be both tablet form and injectable. They are to be used only when the initial DMARDs fail to control the disease. Finally, we can think of surgery. Surgery needs to be done in a deformed joint where medicines will not work and the patient has a significant morbidity due to the affected damaged joint. And the most important thing I would like to stress on is self-care. Keep your mind strong and positive. Anxiety and depression actually increases chance of having RA. So try not to get depressed regarding the disease. Medications will definitely help over long run. Rest to any affected joint is very important in case of acute disease. Do not do vigorous exercise if your joint is painful and swollen. But in the long run, regular exercise is important to keep joint mobility, including regular physiotherapy and other exercises like swimming, running, etc. Control your weight, have a healthy lifestyle with healthy diet, avoid smoking and alcohol, educate and empower yourself regarding the disease so that you can know about the disease more. The more you know, more you tackle the disease. And lastly, do not fall prey to any tall claims who says that they can cure the disease and control the disease very fast. If anything such sounds too good to be true, then it is actually not true. Live healthy, and if you have any queries, consult a rheumatologist. Thank you.